What happens when patients ask me, Dr. Nalbanian, I don't show enough teeth when I'm smiling, or the referring dentist says, looks like I think she's got a tooth wear. But the real essence is, although we try to fix a tooth wear, because if you allow your teeth to be worn considerably, you can lose your teeth. But the most common complaint is that, Dr. Nalbanian, I don't show enough teeth when I'm talking and I'm speaking. And that's a real problem, more for women than men. Women about 40 years of age plus, they have this concern. For men, it's probably about 5 to 10 years later in life. But I don't show enough teeth when I'm smiling and talking. It's a very common complaint. So one reason is a tooth wear. Another reason is because they have, for instance, a gum disease, and the teeth actually move forward. And as they move forward, they create that reverse smile line, which you call a reverse smile line. And basically, they can't show enough teeth when they're talking. They're the two main reasons: the wear, also when the teeth start to move, and naturally they can have, as a child, they have in the front with a tongue thrust, you call anterior tongue thrust, or thumb suckers that can also push the teeth forward. If it hasn't been treated, then they get this aging phenomenon as they hit 40 or so. So one of the things that we do in my practice is to have a look how much teeth display they need to have. And what I'm really looking for is, I like to see a nice pleasing length. I like to see a nice pleasing appearance with with the central incisors being a bit more dominant, and then the lateral incisors, just what the natural smiles look like. And we like to see a nice pleasing appearance of in between the little things, in between the incisors, we call it interincisal angles. And that's really important. Also, natural, that's nice, pleasing brightness. So when we put all those 5 important ingredients into the smile, we realize that somehow this smile can be formed in this way to create the best effect that complements the patient's face. We call it complementing the dental-facial aesthetics. And that's important. So when I look at the next stage, for instance, here we have a patient here. When we have called the reverse smile line, and as I explained before, reverse smile line was, it creates an effect of a negative space. For instance, if you have a really narrow upper arch, you get negative spaces on both sides of your arch. But if you have a really reverse smile, where the smile goes this way, you have a black space, like a black hole in the front of your face. As you're smiling, you're talking, there's a black hole here. And that creates also, from a male and female point of view, very aged look. So people sometimes say, you know what, my smile is older than me. The next question I need to ask, do you feel your smile is older than you? And the answer is yes. There's a good chance that you need to see me in terms of trying to improve the outline and the outcome of the proposed smile design. We should do it every day. In many ways, when this beautiful patient presented in my practice, we knew that was the case. We look at the past photos, etc. We can see how the teeth are worn, and naturally with time, with grinding, with moving the teeth together as a wear, there could be uneven wear, which result in fact of being worn upper central incisors and the lateral incisors, and they're basically showing the dentine. So we had to be able to reconstruct this patient into the natural tooth form, arch form, and position in the head so the whole thing complements to each other. You can see in this particular picture where we have a full complement smile, beautiful lips. I mean, this patient had beautiful lips to complement the smile, and the teeth need to fit that lip, the lip thickness, the lip outline, and in this case, the upper teeth are just touching the special, we call the vermilion border of the lower lip, and that really creates a very natural smile. We looked after this patient for about a good 10 years, and she was regular maintenance. We maintained those veneers for about a good 10 years. However, with time, they do wear. We go through a lot of stresses in life, a lot of things happens in life, and composite veneers don't last long as porcelain veneers, but they're actually a very good modality of treatment, and also much more affordable treatment compared to porcelain veneers. But in my hands, from the aesthetics point of view, it really doesn't matter. You will get the same level of aesthetics for both composite and porcelain veneers. That's not an issue. It's just the material that's the importance, because the composite does not maintain a last as much as the porcelain does. Porcelain, because of the hardness of the surface, when you really give it polishing, we glaze it, it actually maintains its last for a very long time. With composites, you need to come in every 6 months, and during the checkup and the clean, which we ask you to, is part of your maintenance protocol once you've done with us, is to be able to polish those composites, regaining the luster, refreshing it, and that's what we do every time. However, having looked at a patient now, you can see in the final, after 10 years, during those 10 years, a patient has gradually worn her composites. And now, after 10 years, we decided that it was time to replace those composites with porcelain. We also placed a few other restorations in her mouth, and to be able to maintain and take it for the next 10 years, because the teeth had worn quite a bit, we had to place porcelain veneers. Porcelain veneers were placed on teeth that actually had composite veneers. So the teeth underneath, they're very, very intact. We never touched them. So when I removed the original composite veneers, which I placed 10 years ago, we just went back to the original enamel, and that was done without discomfort, without pain, without injections. So that was the important part of the treatment plan we do for our patients. We look at them long term, and hence maintaining the integrity of the dentition, and over which we can come back over and over again and place new restorations, because the most important thing is the biology that drives the restorations. So the biology is the maintenance of the tooth integrity, where the porcelain will come on the tooth and the old composite will removed on the microscope. So this porcelain should last for a very, very long time. Even if we need to, I can still do the same as the composites. I can remove them, go back to enamel, because the basic tooth integrity is maintained. And you can see after 10 years, when replacing the porcelain veneers for this patient, how much younger she looks. Okay, she looks so much younger even 10 years ago when we replaced it with composite veneers. We change people's lives, and how we do this is understanding the facial form, understanding the tooth form, understanding how the whole articulation of the tooth form, arch position in the face. How do you position this smile line to complement this patient's facial aesthetics? And for this patient, I believe we have achieved this. You can see both on the frontal profile, also on the sagittal profile, this angle, profile angle, that she really looks good. And for her age, I think she's 10 years younger just by looking at it. So we have taken 10 years back. I don't have a problem in doing that, because in this particular patient, we have achieved this. And I sincerely believe that we can achieve similar results for you.